your nematodes. Okay. So, number 31 po tayo. Okay, first image. Kaya po ito, no? Easy lang. Okay. And then, for the next image, okay, and then, isa pa po. Ayan. Okay, so alam niyo po ito. This one is, syempre, no? We have Enterobius vermicularis. So, Enterobius vermicularis egg nga po is described to have a flattened on one side and a thick-walled, colorless shell. Enterobius vermicularis, common name po niya if you're familiar with pinworm, seedworm, no? Society worm, no? Because of its familial tendency. Pinworm naman because of the anterior portion nga po of the adult worm is pin-shaped. Okay? And then, again, the egg nga po here is flattened on one side. The specimen of choice for Enterobius vermicularis is a cellophane tape preparation because there is only a 5%, a very low survival in direct fecal smear. Okay? And this one is collected, no, yung cellophane tape preparation from the perianal region of the person suspected of the infection. Okay? Nangyayari po dito, the gravid female or the pregnant or the gravid female worm migrates outside the body to the perianal region wherein the worm will deposit up to around 15,000 eggs. And that will cause nga po itchiness on the perineum or perianal region. Usually po kasi at night yon yung oviposition ng female worm to the perianal region. Hence, we call it as nocturnal pruritus ani. Nocturnal pruritus ani. Okay? Possible din po sa case ng Enterobius vermicularis ang reinfection or auto-reinfection where ibig sabihin the individuals will reinfect themselves kapag nag-practice pa rin ng unhygienic due to unhygienic practices, no? Na kapag hindi nga naghugas ng kamay tapos na-ingest ulit, no? So possible po yung reinfection as well as through inhalation, no? Kasi diba the mode of transmission for Enterobius, since the egg here is already embryonated, it can be transmitted nga po by direct ingestion again as well as through inhalation, no? So inhalation and ingestion. Okay, so again, this shows nga po the egg of your Enterobius vermicularis. Okay, this one as well as this one. So we have your Enterobius vermicularis egg. Okay, next po tayo, number 32. This one. Okay. Next, this one. Okay, ano po kaya ito? Ito yung egg niya, ito yung adult niya. This one is your Trichuris trichura. Tama? So for Trichuris trichura, the common name here is whipworm, no? Kasi yung adult worm dito, attenuated yung kanyang anterior part, kaya mukha daw siyang, meron siyang whip-like appearance, no? Kaya the common name here is whipworm, no? And syempre, this one is causing trichuriasis, or whipworm infection, or common pathology din po dito ay rectal prolapse, no? So rectal prolapse. The egg here is described as barrel shape because of the presence of a prominent hyaline bipolar mucus plugs which is visible at each end, no? So presence of a prominent hyaline bipolar mucus plug visible at each end. Okay? While the adult worm naman po dito, the anterior end nga po is much smaller and looks like a whip itself. Okay, hence the basis of the name whipworm. Okay, so that's for your Trichuris trichura. So again, for number 32 here, so we have your hyaline bipolar mucus plugs, very prominent on each side. And then we have here the adult worm, wherein we have an attenuated anterior portion. So this one is true for your trichuris or trichura. Okay? Next, we have number 33. Okay? Image. Ito po yung image. Okay? Next, ito. Okay? Then, it can also be this one. Or it can also be this one. No? For the different types of egg of this parasite. And then, for the adult naman, ito naman yung adult worm. Okay? Ano po kaya ito? Alam niyo ito, no? Very, very familiar tayo dito. This one, this one, this one, and this one. So, ito po ay your Ascaris lumbricoides. Tama. So, Ascaris lumbricoides is the largest intestinal roundworm. Roundworm of man, no? The largest intestinal roundworm of man. For the egg nga po, the egg can be classified as fertilized or unfertilized. It can also be corticated or decorticated. No? So as you can see here, this one is a fertilized corticated, fertilized corticated, fertilized decorticated, and then this one naman po is unfertilized egg. Okay? So again, that's for your Ascaris lumbricoides. Okay? Then this one naman po yung adult naman po, no, for Ascaris lumbricoides. Okay? So Ascaris worm the Ascaris can also undergo heart-lung migration causing nga po low flare syndrome wherein magkakaroon po ng mga pulmonary and peripheral eosinophilia. So for those that can undergo nga po heart-lung migration, it is true for the larva of Ascaris, strongy, and hookworm. Again, the larva of Ascaris, strongy, and hookworm can undergo heart-lung migration. Okay? Next po tayo, no? Number 34. So in the sputum, we can also recover Ascaris, pero it is in the form of a larva. So what we can recover in the sputum is the larva of Ascaris, the larva of strongy, and the larva of hookworm. Okay, number 34 po, next image. Ito naman po siya. Okay. Next. Ayan. And then, so that's for the egg. Ito naman yung kanyang larva form. Okay, when you check closer, ito po siya sa kanyang larva form. Okay. So again, ulitin ko po. Egg here. Then, yung egg din po dito. And then, ito yung kanyang larva form. And then, closer lang po na view. Ito naman. Okay, ng kanyang buccal cavity. So, this one is, alam niyo po ito, syempre, hookworm. Tama? So, for hookworm po, so for human hookworm, we have two. We have Necator americanus and Ancylostoma duodenale. So two hookworms that can infect man. So this one, Necator americanus is the New World hookworm, while Ancylostoma duodenale is the Old World hookworm. So for the egg po, the egg as well as the larva here, the rhabditiform and filariform larva, we can't differentiate Necator americanus from Ancylostoma duodenale, though we can differentiate them on the basis of the adult morphology based on their buccal cavity. No? Kasi for Necator americanus, wala po siyang teeth, meron po siyang semilunar cutting plate. While for Ancylostoma duodenale naman, meron po siyang two pairs of teeth. Okay? So for the egg at saka for the larva, it is true to all hookworms. So the egg here is described as having a thin shell. So thin shell, colorless shell po siya. And inside there is a visible embryonic cleavage, no? Para nag-divide ng mga na cell, no? Na embryo, no? So around 2, 4, or 8, hanggang 8 pwede, no? Na cell stage na nagdi-divide siya doon. Okay? Okay, and then ito naman po yung kanilang rhabditiform and filariform larva. So, as you can recall, the rhabditiform larva, ito po yung feeding stage na larva. Okay? Tapos it is described as having a long buccal cavity. So mahaba po yung kanyang mouth portion dito. So long buccal cavity or buccal capsules, meron po siyang small genital primordium. Basta lagi pong opposite 'yon, no? So kung long ito, short, small ito, kung long naman po ito, um large naman po ang genital primordium. So in this case, for hookworm, meron po siyang long buccal cavity, so meron po siyang small genital primordium. Ito po ay important because we can use this one to differentiate it with strongy. Kasi sa case naman po ng strongy, short yung kanyang buccal cavity, tapos large naman yung kanyang genital primordium. But for hookworm, meron po siyang long buccal cavity, saka meron po siyang small genital primordium. Sa case naman po ng kanyang filariform larva, ito po yung kanyang infective stage. Tama? Ito po yung infective stage sa man through skin penetration. Okay, so skin penetration po ang mode of transmission for hookworm. Tama po, no? So this was the infective stage wherein this one is described to be sheeted. No? So sheeted po siya. Tapos meron po siyang pointed tail. Okay, so it is sheeted with a pointed tail. Again, mode of transmission through skin penetration. Again, that's for your hookworm. So going back here, again, ito nga po yung egg, no? So we have thin-shelled nga po siya, and then meron nga pong embryonic cleavage, no? And then also this one, no? So you have thin-shelled, no, colorless shell, tapos we have embryonic cleavage po dito. Okay? Ito naman po yung rhabditiform larva of the hookworm. So we should take note of the long buccal cavity present doon. Ayun, and the lack of genital primordium here, or lack of prominent genital primordium. Okay? So in a closer look nga po, we can see na meron po siyang long buccal cavity, okay, na present. Again, that's for your hookworm, Necator americanus, and Ancylostoma duodenale. Okay? And then for the adults naman po, again for Necator americanus, meron po siyang semilunar cutting plate, while for Ancylostoma duodenale, meron po siyang 2 pairs of teeth na present. Okay? Next po tayo. Number 35. Ito po yung image. Okay? Closer look po. Okay? Gusto nyo close pa natin? Ayan. Okay? So this one is your Strongyloides stercoralis. Okay, so this one is your Strongyloides stercoralis. So, actually, yung egg po ng strongy, it is difficult to distinguish it from hookworm. Pero kung sa konting difference, actually, we can differentiate based on the size kasi mas smaller po ang egg ng strongy as compared to the egg of hookworm. No? Pero basically naman po, we can't really, or very unusual na makakita tayo ng egg ng strongy. Because one characteristic of strongy is that the egg already hatches in the small intestine pa lang. So nag-hatch na po yung egg sa small intestine pa lang for strongyloides. So dahil po doon, the primary diagnostic stage, ibig sabihin yung ating karaniwang makikita, no, sa sample natin in case of a strongy infection is the rhabditiform larva kasi nga nag-hatch na yung egg sa intestine pa lang. Okay? So the usual diagnostic stage here, or the primary diagnostic stage, is the rhabditiform larva. Okay? Kaya din po, kung makakita man tayo ng egg ng strongy, usually may larva na po sa loob. Okay? O kaya nag-hatch na nga yung larva, so we have the rhabditiform larva na. Okay? So, in comparison naman po to hookworm, yung rhabditiform larva naman ng strongy, meron siyang short buccal cavity. Kung short ito naman po ay prominent. So, prominent naman yung kanyang genital primordium. Diba sa hookworm, meron tayong long buccal cavity, tapos short genital primordium or small genital primordium. Ito naman, meron siyang, sa strongy naman, meron siyang short buccal cavity, tapos meron siyang prominent genital primordium. And for the filariform larva naman po, meron nga po siyang, this one is already unsheated, tapos meron na po siyang notch tail. Okay, notch tail na present. Okay, so again, that's for the rhabditiform and filariform larva. Okay, so laboratory diagnosis po pala, no? It applies for to both hookworm and strongy. So for both hookworm and strongy, syempre we can perform pa rin direct fecal smear. We can also perform duodenal aspirate, especially if we want to recover yung mga larva, rhabditiform larva. So we can perform nga po duodenal aspirate or specifically yung mga entero test or string test. Okay? Tapos for uh, culture naman po, meron tayong mga culture method, no, such as your Haradamori culture technique wherein we are using yung filter paper to allow the growth of the filariform larva. We can also use your um, and other concentration technique, no, para ma-recover natin yung filariform larva. Okay? So, ayun. No? So, again, this one is for stronchies. As you can see in the image nga po, as you see here, closer look, dun sa kanyang sa kanyang buccal capsule or buccal cavity, meron siyang short buccal cavity or short buccal capsule. Okay? Okay, so that's for number 35. Let's now move to number 36. Okay? Ano naman po ito? Okay, next image. Okay. Okay. Before sagot-sagutin po pala yan, add ko lang po ulit dito, no? Aside nga po sa Haradamori filter paper culture technique for hookworm and strongy, we also have your Behrman funnel technique. Ayan, Behrman funnel technique. Yung po yung gumagamit ng funnel, tapos may cheesecloth, o kaya may gauze, tapos sinasubmerge natin yung stool, o kaya yung soil doon, to allow nga po na mag-culture yung filariform larva. Okay? Going back here for number 36, ito po ulit yung image. Okay? And then, ito naman po. Okay? So, alam na po yan. This one is your Trichinella spiralis, no? Encysted larva. So, the common name here is your trichino worm. Associated nga po with trichinosis or trichinellosis, wherein the larva here will coil up in muscle fibers, becoming encysted. No? So, the striated muscle cell surrounding the larva here is the nurse cell. Okay? So for diagnosis nga po, we can diagnose this one through muscle biopsy. So wherein we will examine yung affected na skeletal muscle for the encysted larva. And then we also have different immunotests, no, such as bentonite flocculation test. No? And then we also have Bachman intradermal test. And we can also perform Sino diagnosis, no, for Trichinella spiralis laboratory diagnosis. Okay, so this one is acquired through ingestion of contaminated pork that contains nga po the Trichinella spiralis larva. So ang ating infective stage is of course the Trichinella spiralis encysted larva. Okay? So however, proper cooking naman po as well as freezing can actually destroy Trichinella spiralis larva. Next po tayo. Number 37. Ito po siya. Okay. So for this picture po, I obtained this one simply in Google. Okay, but the rest naman po is obtained from your reference materials. Okay, so this one is Dracunculus medinensis. So this one is Dracunculus medinensis or guinea worm. So again, Dracunculus medinensis or guinea worm. Kasi lang po natin itong red. Sorry. Okay, so Dracunculus medinensis is the guinea worm or some would also call this one as the serpent worm. Ayan. And this one is the largest and the longest worm, no? In man. And Dracunculus medinensis is recovered by observing yung infected na mga ulcerations for the emergence of the worm. So lumalabas doon sa mga ulcerations yung worm, especially kapag na-expose siya sa cool water, no? So cool water will induce the rupture of the infected ulcers, and then revealing the worm, no, yung Dracunculus medinensis worm. So we acquire this infection if we ingest yung mga contaminated na water with infected copepods. Okay? Containing nga po yung larva ng Dracunculus medinensis. Ito po ay walang treatment. So the only treatment here is to remove the worm. So kailangan po i-remove yung worm. So ginagawa para ma-remove po yung worm, dun nga po sa kung saan may ulcerations or blister, kailangan lagyan ng cold water nga po, okay? Para mag-create ng environment na ideal dun sa adult worm, no? And then, after nun, the adult worm will break through the blister, and then, ang gagawin is we will manually extract the entire worm by coiling it around a stick. Okay? So, ito nga po yung nakikita nyo po dito. No? That's for Dracunculus medinensis. Okay? Next po tayo. Okay, ito po yung image. Okay. Next image po. Ito naman. Okay, again, ito po. Okay, and then ito. Okay? So, ayun. So, this one is alam niyo po ito, this one is our filarial worms. In particular, this is your Wuchereria bancrofti. No? So, Wuchereria bancrofti po and Brugia malayi are the common filarial worms, and Wuchereria and Brugia are causing lymphatic filariasis. Pero between the two, ang pinaka-common po na nagko-cause ng infection nga is your Wuchereria bancrofti among all your filarial worms. No? And this one nga po is a lymphatic filariasis, is causing lymphatic filariasis or elephantiasis. No? So the adult here resides nga po in the lymphatics, while it will release the microfilaria present in the blood. So yung primary diagnostic stage nga po dito is the presence of microfilaria in the blood. Kaya yun po yung ating dinidifferentiate yung microfilaria, no, for us to be able nga po to identify kung anong specific na filarial worm yun. Kung yan ba ay Wuchereria, Brugia, Loa-Loa, no? Mga Mansonella, Onchocerca. So we are differentiating it based on their characteristic microfilaria. So for Wuchereria bancrofti po, we describe po yung kanyang microfilaria as sheeted, no? Sheeted po yung kanyang microfilaria, and there is no nuclei at the tip of the tail. No? So wala po siyang nuclei sa tip ng tail. Okay, so as you can see here, this one is a Wuchereria bancrofti microfilaria. Take note the presence of a sheet, no? So meron po siyang sheeted po siya, and absence of the nuclei in the tip of the tail. Okay, and then likewise here, we should take note the presence of a sheet again, and the absence nga po of nuclei sa tip ng tail. No? So there is absence of nuclei sa tip ng tail. Okay, so again, that's for your Wuchereria bancrofti. Okay? Next po tayo. So for concentration po pala ng mga microfilaria, we are performing Knots technique. So meron tayong ginagawang Knots technique for the concentration of your filaria. Knots, K-N-O-T-T'-S. So we have Knots technique. Okay? Next po tayo. Okay, so ito naman po ay, on the other hand, this one is the Brugia malayi naman po. No? So Brugia malayi is also causing lymphatic filariasis. No? Ang kaibahan po pala, sa Wuchereria bancrofti, it is more common on it is more commonly infecting the lower lymphatics. Para maalala, Wuchereria bancrofti, ba for baba. No? So lower lymphatics. Kaya common po dun yung hydrocele, or inflammation of the scrotum. No? Sa case naman po ng Brugia malayi, para maalala, MAF or mataas, ito naman po ay nasa upper lymphatics naman. No? So, causing infection naman in the upper lymphatics. So, lymphatic filariasis, elephantiasis, again, the primary diagnostic stage here is the presence nga po of the microfilaria. No? And we need to differentiate nga po the microfilaria here. So, ito po ay sheeted din, no? Pero meron po siyang nuclei at the tip of the tail. Okay? So meron po siyang 2 nuclei specifically at the tip of the tail with characteristic bulging. So that is true for your Brugia malayi. Okay? So 2 nuclei at the tip of the tail with bulging. Okay. Next po tayo, number 40. Okay. Okay, so ito naman po ay case ng Onchocerca volvulus, which is also a filarial worm. But this one is commonly known as the blinding worm or blinding filaria, causing river blindness. Ayan. The vector here is the Simulium black fly. So the black fly under the genus Simulium or Simulium black fly. Okay, but in here we can find the microfilaria here not in the blood but rather on subcutaneous tissue. No? Kaya po the specimen here is skin snips, no, for your Onchocerca volvulus. And this one is unsheeted, no? So wala po siyang sheet na present. No? And there is no nuclei at the tip of the tail. Okay, so unsheeted, there is no nuclei at the tip of the tail. So we have your Onchocerca volvulus. So ito po yun. No? So we have your Onchocerca volvulus microfilaria. So again, note the absence of a sheet. So wala po siyang, unsheeted po siya. Okay? So for further differentiation, so we have Buchereria bancrofti, we have Brugia malayi, we have your Loa loa, wherein there is the nuclei here is extending up to the tip of the tail. We have your Onchocerca volvulus, unsheeted po siya, but the nuclei does not or do not extend to the tip of the tail. No? And then we also have there your Manzanella. Okay, so again, that summarizes your nematodes, no? Including the filarial nematodes as well. No? Next po tayo, cestodes. Next, cestodes na po tayo under your metazoans. Number 41. Okay, so for the first image here, I have this. Again, meron po siya ng mga radial striations. Okay, here. Okay, for the egg, this one for its segment. Okay, so ano po kaya ito? This one is, alam niyo po yan, no? Egg, and then yung kanyang segment po na to. So this one is this one is Taenia saginata. Tama? So this one is Taenia saginata or your beef tapeworm associated nga po with Taeniasis or beef tapeworm infection that can cause blockage nga po sa ating gastrointestinal tract, wherein the intermediate host here are cattles, cows, or possible din po ang camels, wherein the mode of transmission is through the ingestion of this meat o kaya beef, no? So the eggs here is similar to your Taenia solium and Taenia saginata. They are indistinguishable. So you can see here that we have a radial striations present, characteristic of the egg of Taenia. And then we have here presence of a hexacant embryo with 3 pairs of hooklets. Okay, so this is the egg characteristic of Taenia, which is indistinguishable for Taenia solium and Taenia saginata. But we can differentiate Taenia solium and Taenia saginata based on their proglottids here. So for the proglottids here, for the segment here, we can see presence of 15 to 30 uterine branches or 15 to 30 lateral branches, and they are described as dichotomous or tree-like. So again, we have 15 to 20 or 15 to 30 lateral branches that are dichotomous or tree-like. Okay? Sa adult naman po, what we can see here, your presence of 4 cup-like suckers. Then for the scolex, which serve as for attachment. Additionally, usually po may presence po dyan ng rostellium, which can be armed with hooks or unarmed. No? Para sa case po ng Taenia saginata, wala po siyang presence ng rostellium. Again, that's for Taenia saginata. Okay, so as we go back here, we can see the Taenia egg. So, Taenia egg po with radial striations here. And then, ito naman po yung kanyang segment nga po for Taenia saginata, wherein we can see here the lateral branches or uterine branches, 15 to 30. So, madami nga po siyang lateral branches described nga po as dichotomous or tree-like. Okay, next, number 42. So, similarly, ito rin po yung kanyang egg. Okay, and then for the adult, we can see na armed na siya dito with rostelliums. Meron siyang 4 cup-like suckers na present. And then ito naman po yung kanyang segment. Okay, showing the lateral or uterine branches. Ang stain po na ginamit dito ay India ink. So we can use po India ink to stain the lateral or the uterine branches of your Taenia solium and Taenia saginata for further differentiation. Okay, ano po ito? This one is your Taenia solium. So, Taenia solium is the pork tapeworm associated nga po with Taeniasis or pork tapeworm infection. Just like Taenia saginata, it will cause nga po blockage in the gastrointestinal tract associated with leading to the manifestation of gastrointestinal symptoms. No? But what is unique for Taenia solium, it can also cause cysticercosis. Usual po kasi na cycle dito is when we ingest nga po the infected pork containing the Taenia solium larva. But it is also possible for us to be infected if we ingest the egg of Taenia solium, and that egg will develop as larva in man, causing cysticercosis in man, no, in our connective tissues. So we have development nga po of or a process called cysticercosis in man. Okay, so which is more fatal. No? So again, the intermediate hosts here are pigs, and the mode of transmission is through ingestion. Okay, the eggs here of Taenia solium and Taenia saginata are indistinguishable. So again, we can see here pareho pa din radial striations, 3 pairs of hooklets here, and the presence nga po of the hexacant embryo. For the adult naman po dito the scolex for attachment, so we can see here presence of the 4 cup-like suckers. Pero what is present here, different to your Taenia saginata, is the presence of rostellium. So meron pong rostellium and Taenia solium, and this one is armed with hooks. So this one is described as armed rostellium. So meron pong hooks na present. While for the proglottid naman po dito, sa kanyang segment naman dito, we only have a fewer number now of lateral branches or uterine branches, around 7 to 15 lateral branches. And this one is described as dendritic or finger-like. Diba kanina 15 to 30 lateral branches described as dichotomous or tree-like. Ito naman, 7 to 15 lang yung kanyang lateral branches described as dendritic or finger-like. Okay? So we can see here the egg of Taenia, we can see here the adult nga po, scolex, and then we have a 4 cup-like suckers, armed yung kanyang rostellium, and then dito naman we have the segment of Taenia solium, wherein we can see nga po 7 to 15 lateral or uterine branches, and then stained nga po by India ink, described as finger-like. Okay, so we have your finger-like or dendritic. Okay, next po tayo, number 43. Okay, ito po yung image. Okay, here's the microscopic image. And then, also, this one. Okay. So, ano po kaya ito? This one and this one. Alam niyo po yan. Okay, this is very important, no? So, this one is Hymenolepis diminuta. So Hymenolepis diminuta, common name is the rat tapeworm. So we can easily differentiate diminuta from Hymenolepis nana through their egg. So very unique naman or distinguishable na yung kanilang egg, di ba? So it contains an oncosphere with polar thickenings. Meron po siyang polar thickenings here. Pero ito po ay walang polar filaments. So wala pong filaments na present. Again, wala pong presence ng polar filaments. Kaya mukha daw nga siyang sunny side up or fried egg appearance. No? For the adult naman dito, meron siyang rostellium pero walang hook. So we call it as unarmed rostellium. Okay? The intermediate host here are fleas. So we acquire the infection if we ingest nga po yung fleas containing the larva of Hymenolepis diminuta. Okay, so again, as you can see, the egg nga po dito, for Hymenolepis diminuta egg, it contains an oncosphere with polar thickenings, pero wala pong presence ng filaments. Okay, so wala po siyang polar filaments. Again, sunny side up or fried egg appearance. Likewise, ganun din po dito, contains an oncosphere with polar thickenings pero wala nga po siyang presence ng polar filaments. Again, described as sunny side up or fried egg appearance. Okay? Again, that's true for Hymenolepis diminuta. Next po tayo. Okay? Next, ito naman po 'yon. Okay? Next image. Okay, again. And then this one. Okay, alam niyo po ito. So kung kanina ay Hymenolepis diminuta, ito naman po yung ating Hymenolepis nana. Okay? So this one is the dwarf tapeworm, known also as the true human tapeworm. So ito po yung most common cestode infection in man, particularly common among children. So yung egg po dito, just like sa Hymenolepis diminuta, contains an oncosphere with polar thickenings, pero ito po ay merong nag-arise na 4 to 8 polar filaments. So meron siyang presence ng 4 to 8 polar filaments. Okay? And then for the adult naman, meron po siya ditong rostellium. Armed rostellium naman po ito. Unlike sa diminuta na unarmed rostellium, ito naman po armed rostellium. Okay? So for Hymenolepis nana, meron siya intermediate host na fleas dito. Pero sabi nga natin, since this one is the true human tapeworm, it will not require an intermediate host because the primary mode of transmission dito is the ingestion of the embryonated egg itself. No? So yung egg dito is already infective to man. Kaya nga po ito yung most common cestode of man, no? Especially for children due to unsanitary and unhygienic practices. Kasi pwede nga ma-ingest yung egg dito and the egg is already infective to man. Okay, so again, that is for Hymenolepis nana. So again, yung egg nga po dito, may oncosphere, may polar thickening, then may presence ng 4 to 8 polar filaments. So meron siyang presence dito ng 4 to 8 polar filaments, 4 to 8 polar filaments. No? Likewise, ganoon din po dito, may presence nga po ng mga 4 to 8 polar filaments. Again, that's for Hymenolepis nana or Hymenolepis nana. Next po tayo, number 45. Here's the image. Okay. Alam nyo na yan, no? Pagkakita pa lang, no? Yung pockets niya, o yung mga egg pockets. Next. Okay. And then, isa pa. This one. Okay na. Again. Diba? Ganda, no? Egg pockets niya. This one. And this one. Ayan. So, ano po ito? Ayan, that's your Dipylidium caninum. Tama? So, Dipylidium caninum is called as the dog or cat tapeworm. Iba tinatawag din siya cucumber tapeworm or pumpkin seed tapeworm kasi punong-puno po siya ng egg dito. Very gravid yung gravid segment ng tapeworm na to, no? So, puno-puno siya ng egg, kaya mukha daw siyang pumpkin seed or cucumber, no? They also call this one as the double-pored tapeworm kasi meron po siyang dalawang genital pore na present. No? Meron siyang dalawang genital pore na present dito. Ibig sabihin, kung meron siyang dalawang genital pore, meron din siyang dalawang set ng reproductive organ. Okay? For Dipylidium caninum. Okay? And then for the egg naman po dito, unlike the eggs of other cestodes discussed so far, which appear individually, those of Dipylidium caninum form an enclosed packets. So meron siyang membrane enclosed packets dito, and each packet may contain 5 to 30 eggs. Okay? Individually po, pag isa-isa nyo yan, yung isang egg niya kamukha ni Tania egg. Okay? Pero yung characteristic nga po ni Dipylidium caninum, naka-enclose nga siya sa egg packets. So, enclosed in an egg capsule or egg packets. Okay, so the intermediate host here are also fleas. Okay, so mga fleas din po yun. If we accidentally ingest the flea, then we can be infected with Dipylidium caninum. Okay, but this one is more common among dogs or cat, no? Kaya nga siya dog or cat tapeworm. Again, that is for your Dipylidium caninum, your presence of egg packets of Dipylidium caninum. Okay, next number 46. Okay, ito po yung image. Okay, and then also this one for the egg. Okay, and then for the segment. Okay, ito mas marami pang for the adult. Tapeworm. Okay, nakuha po yun. Okay, ano pong tingin nyo? Ano pong tingin nyo dito? Dito, for the egg, for the segment, for the proglotid or the chain of segments. And then we have the adult tapeworm. So this one is basically your dilatum. So this was the dilatum or Diphyllobothrium latum or the broadfish tapeworm. The broadfish tapeworm, the largest tapeworm of man. So the eggs actually differ. So dilatum belong to a separate family, as compared to your other cestodes, belonging under Pseudophilidian. So medyo magkakaiba, ibang-iba yung egg niya dito, yung kanyang adult, yung scolex, yung segment, yung proglotid, nag-iba tayo dito. So for dilatum, the eggs differ from a cestode. Kasi kanina they are non-operculated, wala po silang operculum. Pero itong dilatum, meron po siyang presence dito ng operculum, so meron siyang parang cup-like portion na operculum dito, which is parang kagaya ng mga trematodes or flukes na meron nga pong operculum. And then, opposite ng operculum niya, meron po siya itong thickening. So, meron siyang thickened abopercular end. Okay, so again, meron po siyang presence doon ng thickened abopercular end. Okay, so aside from the operculum, meron siyang makapal na opposite ng operculum or thickened abopercular end. Okay? Sa scolex naman po niya, 'di ba usually we have 4 cup-like suckers, yun po yung common. But for the scolex of dilatum, meron tayong 2 slit-like suckers. So meron tayong 2 slit-like suckers. And this is called botria. Itong 2 long sucking grooves na to or slit-like suckers here is called botria. B-O-T-H-R-I-A. And then for the proglotid naman po dito, okay, the gravid proglotids here are characteristically contain a centrally located uterine structure. So meron po siyang centrally located uterine structure that frequently assumes a rosette formation. So meron po siyang centrally located rosette-shaped uterine structure. Ibig sabihin, meron siyang highly coiled na uterus. Okay, so meron siyang highly coiled na uterus. Okay? Review nga tayo, ano bang life cycle ng dilatum? Sa life cycle ng dilatum, kung marirecall nyo po, that is coracidium, procercoid, and plerocercoid larva. So, yung lalabas sa egg, pag nag-hatch yung egg, ang lalabas doon ay si coracidium. So, yung si coracidium po, meron siyang cilia, and it can infect nga po the first intermediate host here, which are the copepods. So copepods po, it will develop to become a procercoid larva. And the copepods will be ingested by fishes. So the fishes now will contain the plerocercoid larva. So magmamature mag-develop yung procercoid to become plerocercoid larva. And the plerocercoid larva is now infective to man. So pag na-ingest ng man yon, it will develop as pag na-ingest ng man yun, the plerocercoid larva will turn to become an adult. So the adult tapeworm now of D. latum, yun yung present sa man, being the final host, okay, in the cycle. So the mode of transmission here is simply ingestion of infected fish with the plerocercoid larva. The common pathology here, as we know, D. latum competes with vitamin B12. Hence, it will result nga po to tapeworm anemia, particularly for development of megaloblastic anemia, because vitamin B12 is important for DNA maturation. So since D. latum nga po competes with vitamin B12, deficiency of vitamin B12 can affect DNA maturation, resulting to asynchronous development, leading nga po to megaloblastic anemia. And megaloblastic anemia is primarily described as having nga po macrocytic normochromic red cell, having hypersegmented neutrophil, as well as pancytopenia characteristic. So low RBC, low WBC, and low platelets. So again, that's for your D. latum. Okay. Next, let's now move to the next cestode. So ito po yung image. Okay. O para po mas malinaw, ito po yung next image. Okay. Ano po kaya ito, no? This one is your Echinococcus granulosus, no? Wala lang po akong makitang hydatid cyst na picture, pero this one is the characteristic adult worm of Echinococcus granulosus, the shortest tapeworm as they describe, no? Kasi meron lang po siyang tatlong segment na present, isang immature, isang mature, at saka isang gravid segment. So this one is your Echinococcus granulosus adult worm. Okay, so for Echinococcus granulosus review po natin, the intermediate host here are sheep, no? While the final host here are dogs or any member of the canine family. Okay? However, man serve here as accidental intermediate host kapag na-ingest natin yung egg na nanggaling sa feces ng dog or any member of the canine family. Okay? Kapag na-ingest natin yung egg na yon, that egg will develop as larva in man known as hydatid cyst. Okay? So in the laboratory po, we can diagnose this one through bentonite flocculation test as saka Casonis intradermal test, no? Or x-ray, no? Mga ganyan. While for treatment, no, aside from the medication, we have a surgery through exploratory cyst puncture. Okay? Pero kailangan may process po yun. Hindi pwede i-puncture lang basta-basta because the hydatid cyst contains protoscolyces inside. Kapag nag-burst yan, pwede mag-spread lang yung infection, no? Ng mga protoscolyces, as well as the presence ng mga hydatid sand. Okay, so again, that's for your Echinococcus granulosus. In particular, what is the diagnostic stage in man nga po is the presence of the hydatid cyst. Okay, so we're done with your cestodes or tapeworms. So let's now move to your trematodes. No? So we have your trematodes or your flukes. Okay, your flatworm, your flukes, or your trematodes. Okay. Okay, yan. Next po. Hindi ko pala nabago na yung numbers. Sorry. Ayan, puro na 47. Last number is 47 and hindi ko na nabago. Okay. So this one is the image. Okay, ano po kaya ito? This one is your Fasciolopsis busci. So Fasciolopsis busci, hindi ko na po nilagay lahat ng trematodes or flukes or flatworms. Nilagay ko lang po yung mga significant at saka yung mga commonly encountered na specimen. Also proven by sila po yung laging nakalagay sa mga atlas, no? Okay, so for Fasciolopsis busci, the common name here is the large intestinal fluke. Ito po yung largest fluke parasitizing man, no? The largest fluke parasitizing man. The egg here is indistinguishable among all your fasciola. So for Fasciola hepatica, Fasciola gigantica, and Fasciolopsis busci, we have a similar egg. And the egg here is described as large, operculated, so meron siyang operculum. This one is unembryonated and yellowish-brown in color. At mukha daw po siyang hen's egg shape. No? Hence, ganito nga po yung itsura niya. No? So mukha daw siyang hen's egg. Ayan. For the adult naman po ng Fasciolopsis busci, wala po siyang shoulder na present. While in comparison to other fasciola like Fasciola hepatica, meron siyang prominent na shoulder na present. So how do we acquire the infection? If we ingest yung mga, basta pag fasciola yan, mga plant or vegetation, containing nga po the infective metacercaria. So plant or vegetation here serve as the second intermediate host. While the first intermediate host here is always the snail bearing the cercaria. And then plant or vegetation here will contain the infective metacercaria, which is infective to man. Okay, next po tayo. Sorry, hindi na po na-update yung numbers. Okay, next. Ito naman po. Okay. So, that's for the egg. And then, para naman po sa adult, ito naman. Okay, that's for the adult. Ayan. So, ano po kaya ito? This one is the egg and this one is for the adult. So, this one is your Clonorchis sinensis. No? Clonorchis sinensis, review po tayo, is the Chinese liver fluke. So the first host will always be the snail, tama, containing the cercaria, while the second intermediate host here are fishes bearing the metacercaria, so which is infective to man. So how do we acquire the infection? If we ingest yung mga infected na fish, no, with the metacercaria. So the egg here looks like po an old-fashioned electric light bulb. So they describe it as an old-fashioned electric light bulb. Okay, then meron siyang operculum dito, meron siya ditong thickened rim ng shoulder niya, and then meron siya ditong small knob na present sa opposite ng kanyang operculum. No? Kaya mukha daw siyang old-fashioned electric light bulb, which is similar to the egg of Opistorchis and the egg of Heterophis. No? So nag-vary lang sila ng konti sa sizes, no? But the egg is similar to your Opistorchis as well as to Heterophis. Ito naman po yung adult ng Clonorchis sinensis, which is similar nga po dito, no, for the adult worm of your Clonorchis sinensis, and the egg of Clonorchis sinensis that looks like an old-fashioned electric light bulb. Okay? Which is also similar nga po sa egg ng Opistorchis and Heterophis. Okay, again, that's for Clonorchis sinensis. Egg, Clonorchis sinensis adult. Okay. Next po tayo. Okay. Number 48. Ito, na-update dito yung number dito. Number 48. Ayan. Okay. And then, so ano po kaya ito? This one is your Paragonimus westermani, also known as Oriental or causing Oriental lung, also known as your Oriental lung fluke. And this one is causing nga po endemic hemoptysis. Hemoptysis meaning blood from the lungs. So ito po, merong case dito ng TB-like symptoms. So napagkakamalan siyang tuberculosis. Okay? Para yung clinical symptoms or manifestations ng Paragonimus westermani. So dito po, again, the first intermediate host will always be the snail containing the cercaria, while the second intermediate host are crabs. So yung how do we acquire the infection? If we ingest nga po yung crabs bearing the infective metacercaria. So for the egg po dito, what is unique here is that meron siyang present dito ng abopercular thickening. So may operculum, tapos opposite ng operculum is the abopercular thickening. Okay? Tapos, pero meron din po siya ditong presence ng opercular rim or shoulders. And then for the adult naman po dito, mukha daw siyang coffee bean. Tama, no? Tingnan niyo yung itsura niya, no? Mukha siyang may coffee bean appearance, no? Yung adult ng Paragonimus westermani. The specimen here usually is a sputum sample. And then what we can recover in the sputum is the presence of the egg, okay, of Paragonimus westermani. So like this one, no? The egg nga po of Paragonimus westermani or the Oriental lung fluke. So meron siyang operculum dito. Opposite ng operculum is the thickened abopercular end. Okay? Ayan, no? Tapos medyo kamukha niya ang egg ng dilatum. Okay, medyo kamukha niya ang egg ng dilatum because dilatum egg under your tapeworm also contains an abopercular os of is an operculum and opposite operculum is an abopercular egg. Okay, halos magkamukha sila ng egg nga po ng dilatum. Okay, that's for your Paragonimus westermani. Okay, next po tayo. Number 49. Ito naman po. Alam na alam niyo yan, no? Okay, so we are now, this one naman po is either blood flux, no? So we are now dealing with blood flux naman, no? So blood flux or your schistosoma or schistosomes, no? So they are called blood flux because the adult stages here are in the blood vessel, no? And they are usually seen nga po together, yung male at saka yung female worm dito, and they are called as the most romantic or dubbed as the most romantic parasites because they perform or undergo nga po perpetual copulation. Okay? Unlike po sa rest ng ating mga trematodes wherein the infecting stage nga po is the metacercaria and the mode of transmission is the ingestion of the second intermediate host bearing the metacercaria. Dito sa mga schistosoma, ang infective stage ay yung cercaria and the mode of transmission ay hindi ingestion kundi skin penetration. So we will be infected through skin penetration of the fork-tail cercaria. So pwede ko ito ng contact sa mga water sources na kung saan nandoon nagsiswimming yung mga fork-tail cercaria. So we can be infected through skin penetration of the fork-tail cercaria. Okay? And then, di ba, after skin penetration, magkakaroon nga po doon ng allergic reaction. And then, the cercaria will lose its tail. Okay? So, cercaria minus the tail is your schistosomule. Okay? Ayan, no? And then, ayun, so that's for your schistosome. Again, it shows here nga po, the male and then the female here, held in the gynecophoral canal of the male, undergoing perpetual copulation. Okay? Okay, last po tayo, number 50. Okay, so we have the first image here. Ito. Yung ano po pala, no, allergic reaction sa mga schistosoma nga po is called swimmer's itch. So, kakaroon po ng localized reaction called swimmer's itch. Ayan. Kapag sa mga hookworm, ground itch ang tawag. No? Kapag sa mga schistosoma naman, we have swimmer's itch after skin penetration. Ayan. Localized lang po yun kung saan nag-penetrate yung in this case nga po, yung fork-tail cercaria sa mga schistosoma. Okay? Next po tayo. Alam nyo to. Okay? And then, this one. Okay? Sige nga po. Pa-identify nga po ako nito. This one is your Schistosoma japonicum egg. Tama? So, paano nyo po nalaman meron siyang small knob-like or small lateral spine. No? So, small knob-like or small lateral spine for your Schistosoma japonicum egg. And this one is the smallest egg among all your blood flukes. Meron siyang small knob-like then saka small lateral spine. Schistosoma japonicum egg. Ito naman, meron siyang presence ng lateral spine. No? Meron siyang prominent lateral spine which is true for Schistosoma mansoni. Tama? So for Japonicum po sa Manson, and the specimen here can be stool or can be rectal biopsy. No? Kasi yung mansoni po, nasa ano po ito, no? Large intestine, no? Mga blood vessels in the large intestine or rectum. Ito namang si Japonicum naman as mga blood vessels naman in the small intestine. While ito naman ay si Schistosoma hematobium, no? So this one is the Schistosoma hematobium egg. Tapos meron nga po siyang prominent dito na terminal spine. Pero hematobium po is found nga po sa or infecting the blood vessels in the urinary bladder, no? So it will cause nga po lacerations in the urinary bladder resulting to a bloody urine. No? And the specimen here is 24-hour unpreserved urine sample. So kung kanina stool at saka rectal biopsy, ito po ay urine sample dapat, or 24-hour unpreserved urine sample yung ideal. Again, that is for Schistosoma japonicum, Schistosoma mansoni, and Schistosoma hematobium. So japonicum, small lateral spine; mansoni, large lateral spine; and then hematobium, we have your large terminal spine. Okay, so basically that now summarizes our discussion for parasitology, starting from your protozoans, wherein we've differentiated the different amoeba. We've also discussed the flagellates, the hemoflagellates, and then yung ating mga sporozoans. Okay, and then it's followed by discussing the metazoans, starting from your nematodes, and then we move to your cestodes, and lastly, ito na nga, no, yung mga trematodes, okay, or flukes or flatworms. Okay, so again, the references po are Bailey and Scuss, Diagnostic Microbiology; Mahon and Lehmann, Textbook of Diagnostic Microbiology; and Zabig for Clinical Parasitology, A Practical Approach. Okay, thank you po, and happy studying.